During an asthma attack, you may notice your casualty coughing, wheezing, struggling for air, looking distressed, and unable to speak more than 1 or 2 words. Assuming your casualty has both a puffer and a spacer, we can treat them using the 4-4-4 technique. Combine the puffer with the spacer. Place the spacer in the casualty's mouth. The 4-4-4 technique involves placing 1 puff into the spacer and having the casualty take 4 breaths. We then repeat that process 4 times and then wait 4 minutes to see if the casualty has any improvement. 1 puff, 4 breaths. Second puff, 4 breaths. Third puff, another 4 breaths. And finally, a 4th puff, followed by another 4 breaths. Remove from the casualty's mouth and rest for 4 minutes to see if they improve. If your casualty doesn't improve after the 4-minute rest, then you should repeat the process again, 1 puff, 4 breaths, 4 times, and rest for another 4 minutes. If your casualty improves, great. They can now go back to whatever they were doing before, crisis avoided.